Now, what advice would you give for healthcare professionals as we're preparing to deal with a mental health pandemic that's going to become of this?
For mental health professionals, I think a couple of things. I've been actually giving some lectures to groups and things like that. I think one is that they don't need me to tell them to be as responsive as they can to their patients and as available and all that. I mean, that's sort of baked into our training already. But there are novel things coming along that people need to be aware of, new uses for existing treatments. I'm involved now, for instance, with people who are doing virtual reality as an adjunct to therapy, and that might be promising for people. I'm involved with companies that have got maybe rapidly acting anti-anxiety treatments coming along that could be very effective and might offer enormous promise as in place of the kind of standard therapies we have right now. We need subjects for clinical trials. I mean, we're doing studies. These things have to be vetted, have to be tested, and things like that, to make people aware of the opportunities for people to participate in those as well. I think there's reason to be optimistic as well as fearful going forward. I think it's really, and I tend to be more in the optimistic camp, but I hope that's valid.
Okay, and I guess the only thing I want to hit on now is then PH94B. You are part of that study. Can you kind of talk about the impact that you think that drug will have?
Yes, yeah, it's something that we've been working on for a number of years already. It's based on the principle of pheromones. Pheromones are chemical substances that animals use to communicate with each other, and it's thought not to play a role in humans, but it turns out that they may very well. There's an area in the nose, in the midline, it's called the vomeronasal organ, and it's where we think pheromone-like substances have their impact. And PH94B is a synthetic. It's a human, man-made, but it's a derivative. It's based on certain pheromones that have already shown to have a little bit of a calming effect in humans that we secrete in our skin or other parts of our body. So it's a synthetic neuroactive steroid that seems to have a very rapid calming effect. It's administered as a nasal spray, and within seconds to minutes communicates directly to the brain, and it's given in very small doses. And we've tested it, for instance, in people who have severe social anxiety disorder, where they are terrified to give a speech or interact socially. They come into the lab, and some people got placebo and some people got the PH94B, and the ones who got the PH94B were much calmer in giving a speech and giving a social interaction than the people who got the placebo. And then again, people with severe social anxiety were allowed to carry it around for 4 weeks. 2 weeks they got the real drug, and 2 weeks they got the placebo. They could use it as needed before a stressful encounter, but they didn't know which they were getting, and we didn't know which they were getting. And again, the folks who got the real drug showed much more reduced anxiety in those situations, much more comfort than the placebo. So that's going forward now into what's called phase 3 for social anxiety. And also it's going to be tested now for people with just adjustment and with anxiety, severe anxiety in response to all the things we've talked about. An adjustment disorder where you're having difficulty with anxiety, just coping with day-to-day affairs and making you, highly distressed or unable to function effectively. We'll see if being able to use this on an as-needed basis can really get you much more comfortable and in a very effective and safe way. So those are the kind of things that's going forward. There has not been anything new in the anxiety field for about 10, 15, 20 years. New developments, new medication treatments. So this may be and this may be safer than the existing treatments and more rapidly acting than a lot of them. So if it works, it's still under investigation, but if it works, it could be a very exciting development that